This is my presentation on cover harmonization for burden testing in neuroblastoma patients. What is neuroblastoma? Neuroblastoma is a cancer that affects and starts in early forms of nerve cells, most often found in embryo and fetus, making it more prominent in children. What are we knowing? We're comparing sequences of DNA from people with neuroblastoma, which we're going to refer to as the cases, and healthy individuals, which we're going to refer to as controls, to hopefully be able to find variants or differences in the sequences that can be connected with neuroblastoma. How are we doing this? We're doing this by rare variant burden testing, which is an analysis that, like in the picture, it looks up for differences in between reference DNA, which is in the purple, between controls and cases, and the variants that are only found in the neuroblastoma patients can be considered rare variants. Burden testing has different steps. The first step is sample selection and quality control, then sample pruning, coverage harmonization, qualifying variant selection and collapsing, and test for association. The focus of my project is in coverage harmonization. What is coverage harmonization? Coverage harmonization is the process in which we compare all the places in the DNA between cases and controls and see if they can be verified to have a similar amount of coverage for us to be able to do an accurate analysis. This is better represented in the picture. If we look at the picture, each rectangle is a site. Each color represents if it failed or passed the filter or the coverage filter. If we look at the first column, one of the sites on the cases failed the filter and one of the sites on the controls failed the filter, but because they both passed a threshold between each other, the sites will be considered. However, if we look at the second or fourth column, because most of the cases in the fourth column failed the filter, that site will not be considered. Same thing on the second column, most of the controls failed the filter, so that site will not be considered. Then the next steps would be, after coverage harmonization is done, the next step will be selection of qualifying variants from the sites that have been verified, and then doing the collapsing analysis and the test of association. With this process, we will be able to find rare variants that are connected with neuroblastoma patients. Thank you.